So we all know that American healthcare has issues. We spend more on health per capita than any other nation on Earth, yet by lots of health indicators, including life expectancy, the US is far behind its peers. Americans are largely reliant on health insurance to afford care, but at the end of last year, around 12% of adults didn't have any. But there's another problem, one that isn't talked about as much. Even when insurance comes through, lots of people aren't taking the medicine they're prescribed. One study suggests that up to 50% of American patients with chronic illness didn't take long-term medication properly. Medical non-adherence can cost the healthcare industry $100 billion a year, and it can cost 100,000 lives as well. Of course, technology is ready to help, but maybe at the cost of our privacy. So first, taking medication properly can be deceptively complicated. We asked our science reporter Angela Chen about it.
There's a lot of reasons why people might not take their pills as prescribed. So maybe there's a lot of side effects that they find intolerable. Maybe they don't trust the healthcare system. Maybe they're getting better and they think, I don't need it. Maybe they're too expensive. Maybe the regimen is really complicated and there's lots of different pills.
Now, there are lots of ways to keep patients on schedule with their meds. There are low-tech solutions like pill organizers that track days of the week, though studies suggest they don't improve adherence all that much.
The problem is people's issues might not have to do with forgetfulness. For instance, there are like these notifications that get on my phone that tell me to go run. I see the notifications, I know I'm supposed to run, but if I don't want to run, that's not really gonna help.
But technology gives us the opportunity to go farther. In the past 10 years, a few apps have hit the market that add a layer of oversight to medication. Apps like eMocha, Adhere, and AiCure help remind patients to take medication, and they use a smartphone camera to actually monitor them doing it. The apps then send the results to the patient's healthcare providers. Some outlets have taken to calling them Selfie medicine, and they show promise.
The Selfie medicine app is part of what we call directly observed therapy. And the main benefit is that you can really trust to a higher level that people are taking their pills. If you really see with your own eyes or through a phone that they've taken it, there's just a lot less doubt that people are on track with their medication.
Right? That was a big one. Okay. How was this experience for you?
I felt a little weird. I'm also not a trained doctor, so possibly doctors would feel less weird about it, but it wasn't my favorite interaction with you.
Well, fine. I'm just gonna finish this water and then hang up.
Alright, see you later, Will.
Bye. As handy as it is, adherence technology raises some questions about privacy and coercion. One, storing your drug regimen on apps and servers is a data security risk. And two, there's the specter of turning healthcare providers into enforcers of drug adherence, which is especially concerning when what you're treating is mental health.
I think first we need to consider that we over-medicate a lot of people. They might not be hurting anyone, but because they don't look or necessarily act normal, we want to give them medication. But a lot of these drugs have side effects. They make you feel groggy, they make you feel like not yourself, and when it becomes enforcement, we kind of take away the right of people with mental illness to decide for themselves. Oftentimes, the people who are most poor, most vulnerable, are most likely to be coerced in taking their medication against their will.
We asked one of the app makers, Adhere, about some of these concerns, and their CEO, Kelly Collins, told us that coercion is not their app's purpose.
We would push back very hard if our application or another like it was used to limit access to health insurance or to care in any way. We're not trying to implement surveillance among these patients. It's more about engagement.
Adhere was originally built for a very narrow purpose unrelated to mental health. It was made to help patients of tuberculosis who need 6 to 9 months worth of medication to get healthy. Otherwise, patients can become contagious again, and TB can become resistant to drugs. It's so scary that the World Health Organization recommends in-person visits with a nurse to make sure patients take every dose. Adhere is designed to ease that burden for everyone involved.
The idea is that this should be a mechanism for engagement and a positive connection between the provider and the patient. This should not feel like an enforcement mechanism.
But does it work? Does monitoring and reminding patients to take their medicine really improve adherence? Adhere has seen some promising results, but broadly, it's hard to know.
I think that's the issue with a lot of these attempts. There's so many different reasons why someone wouldn't take their medication, and each effort maybe only targets one of them. So overall, there's a really complicated picture.
Just as one example, a study last year took patients with recent heart attacks and split them into two groups. The first group took a normal course of heart medication. The second group got the royal treatment. They used a smart pill bottle that kept track of their doses, they got reminders from family members to take their pills, and they got financial rewards for staying on track. And the result?
There wasn't really much difference in the two groups between who took the medication, who didn't, and even more importantly, there wasn't that much difference in who was hospitalized later and who wasn't.
The point is, there's lots of ways to tackle drug adherence. There's selfie apps, support from family and friends, more affordable drugs, and we might need lots of ways. We just need to understand that there might also be lots of reasons people don't take their medicine exactly as expected.
I think that technology right now, when it comes to taking medication, focuses on the issue of forgetfulness. I think they assume that if people just weren't so forgetful, then they'd be rushing to take their pills. I think it's wrong to think of it as so simple, forget or not forget, when there's this whole ecosystem of things that makes medication hard to take.
This is actually one of our first videos about medicine and healthcare, and we want to do more. So if there are topics that you want us to cover, let us know in the comments and we'll check it out. Thanks for watching.